The Supreme Court issues several health-related rulings. House Appropriators advance their FDA spending bill. And Senate Republicans attempt to advance budget reconciliation legislation in the upper chamber. For the week of June 30th, 2025, from Capitol Hill in Washington, D.C., this is Health on the Hill, brought to you by Heart Health Strategies. I'm Matt Duckworth.
Mr. President, we're well on our way to getting this bill passed this week, which means we're well on our way to a stronger and more prosperous America. That means Americans...
Kicking this week's episode off with news from Capitol Hill, where Senate Republicans are expected to pass the budget reconciliation package containing President Donald Trump's domestic policy agenda early in the week. The chamber voted 51 to 49 on Saturday to start debate on the legislation. Senators Rand Paul, a Republican physician from Kentucky, and Tom Tillis, a Republican from North Carolina, joined Democrats in opposition to advancing the bill. Following the vote, Democrats requested Senate clerks to read the 940-page bill out loud. The chamber then began the process of offering amendments with a maximum of 20 hours of debate. After debate concludes, the Senate will begin a marathon voting process known as a vote-a-rama, in which votes will take place on filed amendments. Under the Senate reconciliation process, senators are allowed to offer an unlimited number of amendments, and there's no limit on time for completing the votes. Hundreds of amendments are expected to be filed by both Democrats and Republicans. Republicans adjusted the legislative text to comply with the chamber's rules for reconciliation recently. The latest version of the Senate's One Big Beautiful Bill Act was released early Saturday morning. The bill includes a one-year Medicare physician payment fix to increase provider reimbursement by 2.5% in 2026. The bill would lower the state provider tax safe harbor from 6% to 3.5%, delaying implementation of the phase-down until 2028, while providing for the creation of a $25 billion stabilization fund in response to concerns about the impact of Medicaid cuts on financially vulnerable hospitals. The package restores a House-passed provision to expand the Medicare drug price negotiation program's exemption for orphan drugs to include treatments for multiple rare diseases. The bill does not fund the Affordable Care Act cost-sharing reduction payments, which Senate parliamentarian Elizabeth McDonough ruled ineligible for the budget reconciliation process. Republicans can only lose 3 votes in either chamber and still pass the bill along party lines. Assuming Senate passage, the House of Representatives is expected to return to session this week to vote on the revised bill. Congressional Republicans and the White House aim to have the package signed into law by July 4th. On Sunday, Senator Tom Tillis, a Republican from North Carolina, announced that he will not seek re-election in 2026. In a statement, Tillis said, quote, "The choice is between spending another 6 years navigating the political theater and partisan gridlock in Washington, or spending that time with the love of my life, Susan, our 2 children, 3 beautiful grandchildren, and the rest of our extended family back home." He went on to say, "It's not a hard choice, and I will not be seeking re-election," unquote. The 2-term senator currently serves on the Finance, Veterans Affairs, and Judiciary committees.
Neither of them is that important, but what was discussed this morning, I was watching the meeting online, and they are talking about, revising or, re-examining the entire childhood vaccine schedule. And that's could be very significant. And frankly, just the way that they talk about vaccines is really different than we're used to hearing public health authorities. And this committee, which has existed
The Centers
since
for Disease
1964,
Control and Prevention's Advisory Committee on Immunization Practices, or ACIP, convened a 2-day meeting last week. It was ACIP's first meeting since U.S. Department of Health and Human Services Secretary Robert F. Kennedy Jr. fired all 17 members of the Vaccine Advisory Panel and named a group of replacement members earlier this month. ACIP voted 5-2 to recommend clesrovimab, a new monoclonal antibody for newborns and infants to protect against RSV, and voted 5-1 to recommend against flu vaccines containing the preservative Thimerosal. During the meeting, new ACIP Chair Martin Kulldorff announced plans for the committee to investigate the cumulative childhood and adolescent vaccine schedule. Kulldorff said, quote, "In addition to studying and evaluating individual vaccines, it's important to evaluate the cumulative effects of the recommended vaccine schedule." He went on to say, "This includes interaction effects between different vaccines, the total number of vaccines, cumulative amounts of vaccine ingredients, and the relative timing of different vaccines." Unquote. ACIP will also establish a work group to examine immunizations that have not been studied in more than 7 years. The ACIP meeting proceeded as planned, despite a call from Senate Health, Education, Labor, and Pensions Committee Chair Bill Cassidy for a delay. Cassidy posted on the social media platform X, quote, "Although the appointees to ACIP have scientific credentials, many do not have significant experience studying microbiology, epidemiology, or immunology." Unquote. He stated that the meeting should not proceed until ACIP is fully staffed with, quote, "more robust and balanced representation, as required by law, including those with more direct relevant experience." Unquote.
I call this meeting of the Appropriations Committee to order. Welcome, everyone. Today's markup is the resumption of our markup for fiscal year 2026 of the Agriculture, Rural Development, Food and Drug Administration related agencies appropriations measure, which has been in recess.
The House Appropriations Committee voted to advance its fiscal year 2026 Agriculture, Rural Development, Food and Drug Administration spending bill last week in a 35-27 party line vote. The appropriations measure would provide $6.8 billion in total funding for the FDA, including $3.2 billion in taxpayer funds and $3.6 billion in user fees paid by drug and device makers. This funding level is 4.2% lower than currently enacted levels and mirrors the President's budget request. During the markup, the panel adopted an amendment by Representative Debbie Wasserman Schultz, a Democrat from Florida, directing the FDA to continue to fund the Youth Anti-Tobacco, the Real Cost campaign at current levels. The bill now awaits a vote on the House floor. The House of Representatives passed its first fiscal year 2026 spending bill on Wednesday. The chamber voted 218 to 206 to adopt the Military Construction Veterans Affairs Appropriations measure. Congress faces an October 1st deadline to pass the 12 annual appropriations bills or extend federal funding via a continuing resolution to avoid a government shutdown at the end of the current fiscal year.
Welcome to the Committee on Education and Workforce. In today's markup, we will tackle several bills designed to empower parents with more options for their children, create more accountability in higher education, and make it easier for workers to get and keep the benefits they need.
The House Committee on Education and the Workforce advanced the Association Health Plans Act last week in a party line vote. The bill would codify a first-term Trump administration standard that was rescinded by the Biden administration, which expanded the availability of association health plans. Association health plans are made up of small businesses that coalesce under a single plan and are not required to adhere to the Affordable Care Act's essential health benefit requirements. Final news today comes from what was a very busy week in the closing of the Supreme Court's current term. First, on June 27th, the Supreme Court ruled in Trump v. CASA Incorporated to limit the ability of lower courts to issue nationwide injunctions, or orders that block federal policies across the entire country. The decision comes as several states and advocacy groups are challenging NIH and HHS actions on scientific integrity policies, reproductive health access, and grant funding. In many of these cases, district courts had issued nationwide injunctions to block enforcement while legal challenges proceed. While the decision will not retroactively affect these injunctions, it is expected to affect future litigation outcomes against federal health agencies. Writing for the majority, Justice Amy Coney Barrett emphasized that federal courts may only grant relief to the actual parties before them in a given suit. In the case of Kennedy versus Braidwood Management Incorporated, the Supreme Court upheld the structure of the U.S. Preventive Services Task Force, or USPSTF, ruling that its members do not require presidential nomination or Senate confirmation. The plaintiffs had argued that the task force was unconstitutional because its members were not appointed in accordance with the Appointments Clause and sought to invalidate the Affordable Care Act's preventive services mandate. Writing for the majority, Justice Brett Kavanaugh emphasized that USPSTF members are, quote, inferior officers, unquote, who operate under the supervision and control of the HHS Secretary, maintaining a constitutionally sufficient chain of accountability. The ruling aligns with arguments advanced by both the Biden and Trump administrations, which had defended the Secretary's supervisory authority over the task force. It also effectively preserves the Affordable Care Act's requirement for insurers to cover preventive services, such as HIV prevention drugs like PrEP, at no cost for patients. Justice Clarence Thomas dissented, arguing that Congress had not clearly authorized the Secretary to appoint such influential officials without Senate approval. On June 26th, the Supreme Court ruled in Medina v. Planned Parenthood South Atlantic that Medicaid recipients do not have a right to sue when states exclude providers like Planned Parenthood from the program. The case was brought as a result of South Carolina's 2018 decision to remove Planned Parenthood from its Medicaid program due to its provision of abortion services. The decision is expected to limit patients' ability to challenge state efforts to restrict access to reproductive and other preventive healthcare services under Medicaid. In dissent, Justice Ketanji Brown Jackson noted that the ruling undermines legal protections for low-income patients. We end each week's episode with the call to order, where we lightning round congressional meetings and hearings in the near future that you need to know about. First, on Monday, July 21st at 5 p.m., the House Appropriations Subcommittee on Labor, Health and Human Services, Education, and Related Agencies hosts a markup of their fiscal year 2026 legislation. And last, on Thursday, July 24th at 10 a.m., the full House Appropriations Committee convenes a markup of fiscal year 2026 Labor, Health and Human Services, Education, and Related Agencies legislation. Thanks again for tuning into this week's episode of Health on the Hill, brought to you by Heart Health Strategies. For more information on this week's healthcare happenings in the administration and on Capitol Hill, you can visit our website at hhs.com and click on the news section at the top of the page. You can subscribe anywhere you get your podcasts, including Apple Podcasts, Spotify, YouTube, and SoundCloud. Did we miss a story you wanted to hear this week? If so, email me at mduckworth@hhs.com, and we may include it in our next episode. Have a great week, and stay healthy.